Hello everyone. After the lunch break, now I would request Stuti Jalan, founder Crosshair of and Women Inspiring Network Advisory Board. Has she there? Okay, very good. And the panelists are Shuchin Bajaj, Pushpanjali Chawla, Shailja Mittal, Peter Pushparaj. Please come on the stage.
So may I request all our panelists to join here. But good afternoon, everybody. I'm really glad that we are here with the Galien Foundation, Tower Capital, and the Women Inspiring Network, which is a movement to pay it forward. And I'm really looking forward to our discussion today, the next frontier in global health. So I'm just going to take my seat, but thank you, everybody, for joining us. So I'm really excited with the Galien Foundation, which is of course very known in the healthcare space, innovation, and what it's doing to improve human condition. So I'm really happy that we've got this opportunity to be able to do this discussion. Thanks to Sanskriti, who I met her at Davos during the World Economic Forum. And she was on one of our panels with the Women Inspiring Network, which was also supported by the Bill and Melinda Gates Foundation, the Ministry of Women and Child, and CII. And today we have Dr. Shuchin Bajaj. He is founder director of Ujala Cygnus Hospital. And he's of course going to tell us about his journey. He did win an award at the World Economic Forum with the Schwab Foundation on healthcare innovation, so he's going to throw some light on that. I have Pushpanjali Chawla. She comes from the legacy of the Ayurveda family Bednath, and she's going to talk about how the two converge, the traditional medicine and the modern medicine. On my left is Shailja Mittal. She's the founder of Curex, and I'm really happy that she's going to be talking about a subject, because Women Inspiring Network is all about shaping conversations. So she's going to talk about how sexual health in women is very important for the importance of well-being, and she's going to talk about her app, which she's developed. And then, of course, I have Peter Pushparaj, who is the CEO of AI Nexus Healthcare. And he's of course going to talk about the healthcare innovations, the kind of work which they've done in South on women and health. And I did happen to meet his founder in Davos, who was also a speaker in our panel. So today our discussion is going to mainly focus on around the kind of advancements in regenerative medicine. What is the kind of potential on the global health space which we'll have? We'll touch about Ayurveda, on why the Yogvahi is so important, and the conversations are happening already on the space of traditional medicines versus the modern sciences. So these are some of the things we're going to talk about. Health span, how we can improve our lives. And of course, we're going to talk about why sexual health is important for the well-being of women. So now my first question to you is, Mr. Bajaj, I would want to know, since you have won an award on the healthcare innovation space, about what was the award all about, and in your own words, please tell us about that. And how do advancements in regenerative medicines aim to improve healthcare outcomes globally?
Thank you very much, Stuti, and thank you very much to the Modi Galien Foundation and WIN for having us here and giving us a chance to talk about the future of medicine, as it were. Davos was a wonderful experience for all of us, I think. The award was on the social entrepreneurship space more than the innovation in medicine. So I won the Global Social Entrepreneur of the Year award for providing healthcare to communities that don't have access. We run hospitals and healthcare systems all across North India, catering to communities that are deprived of high quality healthcare access due to geographical or social or financial reasons. So most of our hospitals and clinics and digital health initiatives focus on communities that are in the hills of Kumaon or Kashmir or the villages of Uttar Pradesh, Uttarakhand, all of that. Regenerative medicine has been close to our heart because we see on a daily basis, we work a lot with diabetics and hypertensives, and we know that out of the 70 million plus diabetics present in India at this moment, 1/3 of them will end up in kidney failure, right? And the queue for a kidney replacement or a kidney transplant runs into years and years, and there are many who will die just waiting for the kidney to be sourced, because it is a very strict environment, justifiably so, of course. And we do not have access to enough organs for transplant. Even if the organs are available, the lifelong immunocompromised therapy that goes on really hits you both financially as well as physically. The outcomes can be very poor. So we've been working a lot on regenerative therapies, especially stem cells and machine printed joints. We've got to yet, not organs as such, but I feel that is the future of medicine, especially joints. We've had very good success when we are doing knee replacements. A machine printed joint gives much better outcomes compared to a joint that's made in a factory, which is a standard joint. So a 3D printed joint that we use, I think that's something that's giving us really great outcomes even in the rural settings that we use it in.
Lovely. And of course, Pushpanjali, I'm going to ask you that tell us about your family's legacy with Vedanath and how it's influenced your approach. I remember you telling me that when you were a child, you were brought up with the Veds, giving you the teachings. So if you could throw some light on the role it's playing in the modern healthcare practices.
Absolutely. Thank you, Stuti. Ayurveda is a 5,000-year-old science. And my family, through Vedanath, has been nurturing this knowledge for over 100 years. So naturally, ever since I was born, I was pretty much engulfed in this Ayurvedic way of life. And what that did was that it instilled in me a profound respect for natural healing and holistic well-being. It taught me that the balance between the body, mind, and the spirit is essential and actually forms the cornerstone of good health. So in advancing Ayurveda in today's world, I aim to provide a bridge between these ancient learnings and contemporary science. I really want to advocate for a healthcare paradigm which values prevention as much as it values curative measures. And that lays a whole lot of emphasis on lifestyle and diet as the bigger piece of the puzzle that is healthcare. And finally, that also recognizes that we need individualized treatments, not just generalized treatments. You see, modern science is a life-saving science. So for all acute conditions such as car accidents, heart attacks, fractures, Ayurveda has no answer. You need modern medicine. But for all chronic conditions, even the cold, cough, sinus, modern science has no answer. It is a symptomatic approach. So we go after the symptoms and we suppress the symptoms, because most of these illnesses are born out of a bad lifestyle or a bad diet. So that's where Ayurveda comes in, because it's a preventive science. So the beauty is that modern science and this ancient teachings of Ayurveda, not only should they coexist, but they should complement each other to provide a complete solution to people.
Yes. And of course, we can touch upon, and maybe Sanskriti can later add on the generational part of Ayurveda.
Absolutely.
That I will, of course, ask. And Shailja, tell us the reason, why you founded Corex and why the sexual health is very important for women's overall well-being, and what can women do to prioritize it. it's a subject, earlier, as you know, how we are in India, and we've never really talked about it very openly, and I'm really glad that you have a platform to talk about this, so I'd really like you to throw some light.
Thank you, Stuti, and thank you, all of you present here. So, Stuti, to answer your question, why Curix was found. So, after my first startup, I was thinking that I need to make another impact. Through my first startup, I worked on women empowerment. So, after that, when I was thinking that how do I do something which, of course, is a business and it actually creates an impact too. So, at the same time, one of my very close friends got divorced, and when I got to know that he, even after being a friend for 15 years, I never got to know that he was actually fighting a sexual dysfunction in his life, and that was the reason they got divorced. So that just intrigued me to understand that what is this space, and why in this era where we are moving towards robotic surgeries and everything amazing in healthcare, that why a person couldn't find a healthcare solution, and their marriage actually landed in a divorce. So that was the trigger, I would say, which where I started this research 2 years back. So that is how Curix came into picture. So coming to the next part of your question, which asks that why is it important for women overall well-being? So although sexual health, we all know that is actually the base of our life. That is what sex is, something where because of which we all exist. So it's a very important aspect of our life. But yes, the sad situation is that I mean, due to some reasons, we think or our older generations thought that it's not good to talk about sex and sexual health. So that is something which, of course, we all need to work on. But yes, it's important for both male and female and all the genders, I would say, which exist. But yes, specifically talking about women. So women, we all know that they're little more emotional than males, just little more. And that is why they need that emotional bonding more than the physical bonding in any relationship. So coming to the most important part of their relationship, through which then carries down to their children and to their other relationships, which is their, I would say, the better half or the partner. Till the time that intimate bond is strong enough where they feel emotionally bonded to their partner, I think they cannot, they do not feel totally in the relationship. And this definitely affects not even the relationship, but the mental health, the physical health of the woman also. We all know that. That makes her feel more confident in herself, that makes her feel more in herself, that okay, I am loved, I am wanted. So that's of course there. And yes, the last thing that you said, that why, what can we do to make it more important for women? I think the only thing I would say is to talk, be vocal, and to be vocal to your partner, be vocal to the expert if you want to, but yes, talk.
Stuti, I would like to add something to that. In Ayurveda, which I said is thousands of years old, there are 3 pillars of Ayurveda. We call it the Tristambh in Sanskrit. So the 3 pillars are actually food, sleep, and sex. So sex was never something that was a taboo culturally for India. It has become a taboo over the last few years. But what we see nowadays, because there is a lot of sexual frustration, the way that it manifests is that people are more short-tempered, they are hot-tempered, they are restless, they are not able to focus. And a lot of it, according to Ayurveda, comes because your chakra is blocked, which is all the way at the bottom of your body, the one that's your sexual chakra. So if your sexual needs are not being met, your chakra will be blocked, so you will not be grounded as a person. So what Shailja is doing to promote more awareness on why sex has to be normalized, and as she beautifully said, has to be talked about, is so critical, and Ayurveda supports that 100% as well.
So I'm really glad. Actually, I was going to tell that Pushpanjali, I'm going to come back to you, because Pushpanjali did mention it to me this morning. about that, and I of course didn't know about it, but thank you for enlightening the audience on that. And since we are a women's network, we'd like to shape these conversations. And I'll come back to you, Peter. So the AI Nexus, of course, strongly believes in increasing the health span for everyone. And can you elaborate on this and the 5 key pillars of health to add years to your health span, and some of the work which AI is doing in India?
Yeah. What we felt is India is a large continent. You know, we've got about 35 states, 6,25,000 villages, and 7,900 plus towns. So we have a whole different strata, different cultures, all merged in one big country. All right. So the biggest challenge that India was facing is that not only the size of GDP which we are operating, but also the percentage allocated to healthcare infrastructure and framework that we need to put in. That is about 1 to 2% compared to the world, which is higher GDP ratio of developed countries, and allocation of funds about 7 to 10% of the GDP. So this was the basic challenge. And when we started as AI Nexus Healthcare, and we drilled down and said where is we can make a difference is in the non-communicable diseases and mental health and substance abuse, which is very, very strong in India, which is about 74% of these diseases are used because of death caused by them. So, but the whole idea is that this can be prevented, right? With a preventive approach, we can prevent this, and 80% of all these diseases can be preventable. So the first thing is, when we looked at an application of technology, what we looked at is how do we bring the AI application as a technology to bridge this gap. And what is the first thing that we needed to do was, how do we identify the non-community disease size, which we don't have a library or statistics in India. So we developed a platform, AI Nexus Healthcare platform, which does simple understanding of how the disease can be screened, how the disease can be identified, and what kind of an intervention can be planned, how we empower the individual on one side, and how do we give the caregiver as a doctor to look at it and take a quick or a fast interactive. So coming to the idea of, in terms of the critical part of improvement in, for us is also, it is the cost of delivery. It should be there. It should make a sustainable, scalable model when we want to bridge this gap. And we focused on the 5 pillars, what everybody is discussing about. One is, we all ignore sleep. We think we are great people, and with a new lifestyle of people working in the IT industry, where the time zones are very, very different, and so sleep is one of the biggest places. Second is the diet. One end of the industry or the township, we have malnutrition. Another end is obesity. So we have the 2 ends of challenges, which are diet based. The other is the exercise. I don't know, many of the time when we were working in the industry, who saw the sunlight, because they come very late in the nights, in the morning, and they don't see the sunlight, and so don't see the exercise. The only time they get back is on the bed, and they spend a lot of time on the chair. So you have this exercise, which is the basic requirement, which is being ignored. And obviously the other is the lifestyle. Our lifestyles have changed from cooking to Swiggy, ordering straightforward foods, and both women and husbands are working, so there's no time span. So it's again a simple thing of lifestyle changes that they need to adopt. And the other one is basically your mental health. And we found in India, it's a stigma is the mental health. Whereas in US, everybody's got somebody to talk to, and you compulsorily need to go there and say, boss, I've got this problem. Whereas in India, if you say mental health, they straight you put you into some mental home. And nobody wants to say that I've got mental health, because you will not get a wife or a husband. So it's a huge stigma. So, but that is causing a lot of issues from a very young generation of adolescents where people are unable to communicate to also to the other end of part. So this is the 5 areas that we are focusing on at this point, and we are working the first breakthrough that we have got, taking our wellness app into the healthcare of Karnataka government, Department of Health. This is the first application that we are going to do about 1 million screening of age from adolescents, that schools, we're covering 6,200 schools, we are covering about 4,000 education institutions and about 625,000 homes, and all of them, for Stuti, the win, 50% are women. Whether you like it or not, God has devised it that way.
I'm really glad, Peter, you brought on that angle, and of course you did mention about the 5 pillars, and I must add that mental health is something now people are sort of, they're more vocal about it. So in fact, as Shailja also talked about sexual health, so I feel sexual health, mental health, and everybody's now become more cognizant of that as a fact. And this is going to be a common question to all our panelists here. So, how do we believe that, or what are the key opportunities and challenges in integrating the traditional medicine with modern technology? If you'd like to throw some light on it, if you'd like to start, and then...
Yeah, sure. Thank you, Stuti. I think brilliant thoughts from all the panelists, and it's actually at heart I am also a preventive medicine doctor, even though I practice mostly super specialty, tertiary, emergency care in towns that don't have access. Because I truly understand that the cost of the disease goes much higher if you intervene at a later stage. And I have made it my life's mission to make sure that access to high quality healthcare is completely dissociated from your financial or social abilities. So it is very close to my heart, and we need to start by looking at really what is the cost of the disease, right? Because we fail to estimate the real cost of the disease by a wide margin. So let's go back to the example that I told you about the diabetics in India. We have 70 million diabetics, right? We know 1/3 of them will end up into kidney failure. We are amputating 1 foot every minute due to diabetes complications. Now, if a patient with a kidney failure or gangrene of the foot comes to us, what really is the cost of that disease? Do we understand? We can pat ourselves on our backs and say, oh, we'll do free dialysis for you, or we'll amputate your foot for free because we are a low cost hospital, and if you were to go to Delhi to get it done, it would have cost you say 50,000 rupees or 1,00,000 rupees. Are we saving that 50,000 rupees? Is it the real cost of the disease? It's not, right? Because once we've amputated your foot, once we've put you on dialysis, which you need to get it done twice every week, you can't really go back to the factory you were working in or the fields you were working in. You're out of a job now because you are truly into healthcare system. We will keep calling you into the hospital again and again and again. So the future earnings that you lose runs into lakhs and lakhs of rupees. Who's estimating that cost? And the scariest cost is not even this indirect cost that we talk about. The scariest cost is the intangible cost of the disease, right? Because you are out of a job now, you will pull your children out of school and start sending them to work. So one of my colleagues who drives me around all these hospitals that I keep visiting in the north of India that we run, so he always tells me that I used to come first in school till 6th in 2 subjects, maths and races. Every race I used to win, and I always used to stand top in maths. But then suddenly my father died. I don't even know why he died. And then my mom said, now you have to go to work because you have to earn. So if his father had not had that health condition, if his father had survived, he may have been doing something very different rather than driving a car now. So these future generations that are, pushed into poverty, that cost of disease nobody is estimating. So I would like to add to Pushpanjali's point about how Ayurveda and personalized medicine is so important. Right? The problem with allopathy, which we practice, is that for diabetes, we will tell a 5 feet nothing person living on the east coast of India, eating fish, eating rice every day, we will tell him that the same medicines that were tested on a 6 feet 2 inch Caucasian living on the east coast of the United States will work on you because they worked on him, right? Because that is where the data is coming from. So the personalized medicine, the preventive medicine, that allopathy can never succeed in, because we are based on a very wide mass evidence based system that we run. It can never become personalized. It's like asking a chimpanzee to play very high quality piano, right? The keys won't fit. We are too clumsy to do that. The keys only will fit with Ayurveda or other systems of personalized medicines that will push it forward, will see all the pillars of the person, the chakras of the person, the pith of the person, the vap of the person, whatever, then will personalize the interventions according to that. Of course, the challenges will remain. Challenges will remain that we are used to evidence-based practice. How do we create evidence in favor of Ayurveda? How do we make sure that people trust it enough to, put their life into its hands, making sure that I will not develop kidney failure from diabetes if I do these Ayurveda interventions? Where's the evidence coming from? So the regulatory and the evidence-based challenges will remain still. I don't have a solution to that right now, but I truly feel that we need to integrate, and the allopathic doctors and the IMAs of the world, we need to step down from our ivory towers and accept that there are better solutions than what we are offering to patients and to our communities.
Your thoughts, Pushpanjali?
I think Shuchin framed the challenges really beautifully and very concisely. That, one thing is that from an Ayurvedic perspective, there's more scientific rigor that is needed. So there is validation, because all the new platforms, health platforms, they need a stamp of validation to include you. So for Ayurveda to be included, we do need that. Another challenge I see is that, amidst commercialization, we have to be very careful to protect this traditional form of medicine. And finally, again, something that Shuchin mentioned in terms of challenges is just navigating the regulatory landscape. That is a huge challenge for us. And even though it's a 5,000-year-old science, there isn't the sort of regulation around it that is around allopathic medicine. But I'm so much more excited about the opportunity that technology presents us with than the challenges. When Peter was speaking earlier, I was talking to him even before the panel. I think AI and machine learning algorithms can be the biggest champions for Ayurveda. And the reason is that, Ayurveda says that just like no two fingerprints are the same, no two people are the same. So, of course, we have this Tridosha doctrine that Shuchin touched upon, that, everybody is broadly categorized into Vata, Pitta and Kapha, Prakriti or constitution. Still, when a treatment is needed, we further individualize that treatment, to that very person. Now, just imagine if we can give our healthcare providers the correct artificial intelligence and machine learning algorithms to go through vast data sets, right, and identify individuals. So when we give them a healthcare solution, we use modern medicine to cure them of their acute conditions first. But the treatment doesn't just end there. That comes with a blueprint of long-term health, which is based in the Ayurvedic science, right? So, okay, you have a problem. Let's first fix you. Let's take care of the symptoms. After that, this is what you should be doing with your lifestyle, with your diet, and also in terms of balancing, your spirit, mind, and body, so that you can truly live a long-term healthy life. I think that amalgamation today is possible because of AI, and if we can just use that and we can push it out to our healthcare providers, that would be a game changer.
So I'm actually going to come to Peter first, because Pushpanjali has touched upon. So what do you think about AI's intervention in modern medicine and Ayurveda, and if you can throw some light? I've pivoted a bit.
Just off the. I've extensively traveled across all the 35 states and the tribal places. But I must tell you that there's more Ayurvedic treatment in India than nowhere in the world than allopathy. Allopathy is not penetrated as much as Ayurvedic is penetrated. That's our traditional way of handling. I remember one place that we had to do some kind of a health camp. Guys refused to take allopathy medicines. He says, this is what I want. And we're looking at tribal population where they purely stay on Ayurvedic medicine. And in the modern science, modern world, what I call it the ice age, what is called the information, communication and entertainment age. Then there is also the industrial age and there is also the agriculture age. Our Indian families are mixed with all the three. So we have your traditional grandfather, you go to the village, when you have a cough, your grandmother is mixing something and giving it to you. Your father is telling something else, or a mother saying take strepsils or take some antibiotics. And the information communication age is Google searching to what to do. So typically when a person comes to meet somebody, they've used all the three interfaces. Trust of a traditional person from grandmother. She says, this is your grandfather did, great grandfather did, blah. Your father and people are industrial, they've been into all the hospitals and so they know, understand the basic allopathy medicine. And the information don't trust anybody except the Google. So how does we fit in as a technology in this space? Is first of all the ownership of the type of treatment or what kind of a method they want to use is, as we say, the ownership is with the individual patient. All right? So the ownership is the choice of treatment protocols are there. What does AI does? AI is not a treatment protocol. First primary objective for AI is to understand what is the risk factor and diagnose the risk factor. All right? The second play it plays is in terms of the advice, what in general health, it doesn't say take your medicine, take this or not. It identifies that. Then comes the two part, the choice. I want to choose an allopathy medicine, that's a treatment protocol. That treatment protocol, everybody says, if I take it for 3 days, the 5th day I won't see a doctor. Whereas allopathy medicines keep taking for next 30 days, come back to me. Nobody wants to, and plus you can't eat this, eat this, eat this, eat this. So there's a thing. But in both the cases, AI can support this particular treatment protocols as part of a platform specific by choice. We can create that. The second level it happens is when you do the intervention of using the technology, what it does, the moment of truth. 3 days later is the fever gone, or 1 month later does it work for this individual. So it is very specific and personalized. You want to know whether this worked for me or didn't work. So that's when you get an early, when you keep working with it, when you get an individual not working, you can actually intervene and change the plan.
Yeah.
And what worked doesn't mean it will work for everybody. But it worked for it, but over a case period of time, you get it. Alright? So I feel the AI is an enabler and a game changer, but it got a huge amount of data analytics that we can work, the tribes, what we're doing. One of the medications we found, one of the doctors from armed forces found, the Nepali armed people, the Gorkhas, could not take certain kind of a painkillers.
Yeah.
Alright, so A, it can work for somebody, B, within the sets of geography that we have, you know, it can change many things.
So I'm glad, Peter, you sort of brought in, because how India as a country is very, very diverse, and the interventions you talked about, that's exactly what we all saw during even COVID. There were people who were going for Ayurveda, there were people who were going for advanced medicines. So, you know, the combination always works for us. So I'm really glad you brought in. Shailja, I'm going to ask you, how can we encourage more open conversations about sexual health, particularly the sexual dysfunction which we have on relationships, to better support the women who are facing this? And have you done anything specific in that space, if you could throw some light?
Thanks, Stuti, for the question. So, first, how to start more conversations around sexual health. As I said, that we need to be more vocal. And first, we need to actually destigmatize that the conversations around sexual health, and it actually starts from where we are born. So we need to start, and that's what we do also. So we have a small wing at Curix where we reach out to schools. We've created some sexuality education courses which are completely technically driven, and we reach out to schools and give this education courses for the kids starting at the age of 3. So there are 3 versions, 3 to 8, 8 to 13 years old, and 13 to 18. So basically these conversations have to start from that age where we tell them the other body parts, but we generally skip the genitals. We do not tell them names to them. We tell them what are legs, what are hands, what are face, what are mouth, but we don't tell that what are the actual names of the genitals. So actually the conversation has to start from there so that they understand that it is also a body part and it's okay to talk about it because it's important to talk about it. So that is, I feel that that is the place and that is the age where the conversation has to start. And sorry, what was the second part?
So what I was going to talk about, that how can we better support women facing these challenges?
So to support women facing these challenges, again, we have to be supportive. So for example, very small thing, apart from sexual dysfunctions or like women facing vaginismus, painful sex. So it's important to say that, okay, it's okay to have a low sex drive, it's okay to have painful sex, it's okay to have period pain. We need to just accept it as anything else. As we we are trying to accept mental health, we have to start accepting these things as well.
So I'm really glad sort of you brought that in. And of course, we're also going to talk about the new technologies in healthcare in this particular space. We're going to sort of discuss a bit on gene editing and immunotherapy and how that could change disease treatment and bioavailability enhancing strategies in Ayurveda treatments and the solutions which are needed in the AI space and leveraging that. So I'm going to ask you, Shuchin, how might gene editing and immunotherapy revolutionize the treatment of diseases in the near future?
Yeah, so see, technology is an integral part of medicine and will continue to be so, right? Some people say that doctors are not really used to working with technology, they don't accept technology so easily. I think nothing could be farther from the truth, right? The stethoscope that we use is a piece of technology. We've been using complicated machines like MRIs and CT scans forever. Before the accountants switched from calculators to computers, we were already using CT scans and X-ray machines. So it's unfair for people to slot doctors as technologically naive people, and I think that is how the latest technology is coming in. One of the nominees for tonight's awards, I think, is the CAR-T cell therapy, the chimeric antigen receptor T-cell therapy that is revolutionizing cancer care now, right? I mean, things that we were considering to be absolutely incurable in terms of B-cell lymphomas and acute lymphocytic leukemias. I think those treatments are revolutionizing everything, and the pride is that IIT and Tata Memorial have developed it in India, IIT Bombay, and they've developed it at a fraction of the cost like we always do, right? Chandrayaan is a big example, the Mangal mission, and this CAR-T Indian therapy that has come out, I think it's less than 10% of what it's costing in the US now. So gene therapy is CRISPR again, treating so many diseases. I think, as I said in the beginning, the need for newer organs, longer life, healthier life will be in the future replaced by regenerative therapies, gene therapies, and making your own cells bear the cost of the medicine and the treatment rather than putting in newer things from outside. So as I said, CAR T, one example, then stem cell replacement, another example. We're trying to create organs from that. So I think the future is immense, and we are looking forward to a condition very quickly, I think, when immortality won't be out of the window.
Yeah, that's lovely. And of course, I'm going to touch about, and this is something which I was speaking to Pushpanjali the other day, and she was telling me that how the Yog Vahi aligns with the contemporary understanding of bio enhancement and bioavailability. That's a term which is being used a lot on modern medicine. So if you can throw some light on that so that we can intersperse the two.
Sure. So, Yog Vahi, which is a Sanskrit term from Ayurveda, basically means, is the same thing as bioenhancing and bioavailability. Now, I know in this gathering of brilliant minds, I don't really need to explain what bioavailability is, but I'll touch upon it very briefly for anyone who's not from the medical field. So, in layman's terms, if you take, say, vitamin C 1000 mg, how much of that 1000 mg is actually being absorbed by your body and hence being made available to your body is what we refer to as bioavailability, okay, or Yog Vahi in Ayurveda. Now, why this is very important is that, if you are having vitamin C, fine, it's just a vitamin, but what if it's medicine for a very serious illness like cancer, for example? So the dose that the patient is having, if the entire dosage is not being absorbed, the doctor has only one choice, and that is to increase the dosage. Now, in some cases, that may not be possible because increasing the dosage may make it counterproductive. In other cases, increasing the dosage would also mean giving you more side effects. And every time you increase the dosage, you're also increasing the cost and hence access to the medicine like Shuchin was talking about earlier, which is very important. So this is where the concept of Yog Vahi comes in. So imagine if you can take a medicine and combine it with something very natural that does not affect its efficacy. In fact, it enhances its efficacy. So it makes it more effective, and also it makes it more easy for your body to absorb. So actually, what's so brilliant is we don't even have to imagine it. So there is a drug, it's called paclitaxel, okay, paclitaxel. It's a cancer drug which is used in certain chemotherapy sessions. Now, without getting too technical, the transformation of paclitaxel at its nano dimensions was achieved by combining it with two bioenhancers, which are piperine and quercetin. Okay, piperine is basically an alkaloid derived from black pepper. Quercetin is just a plant pigment. And in Ayurvedic texts, which are 5,000 years old, they mention piperine and quercetin as bioenhancers or Yog Vahi that can be combined with medicine. And today, this is being used for cancer-fighting drugs. So what that shows to us is that this concept of Yog Vahi that has existed in Ayurveda for so many years, it's not just relevant today, but it can be used today to fight even new age diseases like cancer, which did not exist 5,000 years ago. So, just the immense wealth of knowledge is there, and we just have to tap into it and use it in a very comprehensive way so we can further what we are doing today.
Yeah. And Peter, I'm going to ask you, how are you making it easier for everyone to live healthier lives despite our circumstances? Of course, you did talk about the 5 pillars, but I don't know how many of us are really adapting to it. And what is the 60-second health risk assessment, if you could throw some light on that?
All right, the base thing the app looks at is, first of all, is this person under risk or not under risk? Why it is evident is because why we are ignoring many of these, as you said, the sleep, walk, we know about it. But if I get triggered and say as a beginning or a starting point as this is my risk, all right, that I am it, this is my state of health, and where should I be if I change my lifestyle or what? That's the baseline of it, all right? So the app identifies what is the baseline risk understanding of where do you stand today and where should you be. The second is makes you understand, right, what you should do with this risk. Okay. Is it reversible, not reversible? What kind of intervention that you need to carry out is the second part of it. Understanding where I stand at the risk factor and how I can avert it. That is the second part of the game. The third is basically is the idea of if I have a risk, I have it, but how do I monitor constantly to keep my change going on this, right? So monitoring is important. So the app should be capable of at any time, any number of time I'm able to use and screen and understand where do I stand today, all right? So it's able to understand what am I doing today, all right? Can I avert it? What is my next step? Can I make a change in my programming? Sure, it should be able to monitor whether I'm doing the right thing or the wrong thing. So constantly is talking to you or is being managed by you personally. The fourth is the alert. One is to understand have I got the whatever disease or non-communicated entered in my life or is suspected in my life. So if it's there already, at least you know it's there and you can take some action and you can, whatever action is recommended, not by us, but it allows you to go to the respective doctor and then take the next level of the thing. And if it's under starting point or is suspect, you know, and the advices that is given, what to alter your lifestyle or whatever is the basic. But if does require an intervention from a doctor, it goes to the next level. So there's a 4 set of things that we really look at in terms of our app. And the 60-second app, right, if all of you are being good to me in this conference and you're nice and smile to me after this, I'll give you a free trial of this app because now it's available on the phone. All right? By using the smartphone, AI Nexus is able to, using the finger or your face scanning, in 60 seconds, it tells you what's your risk factor of your heart rate or heart health, your respiratory health, your metabolic health. All these are codified in green, red and orange based on your personalized profile and health data. So today, you have something to manage, and if you're able to educate and get people manage their own health, what will be the health outcome of India today?
Yeah, I like that thought. And of course, Shailja, I'm going to, because you also have a technology app and so if you can tell me a bit about Corex and the solutions it's providing for women from a sexual health, mental health, and how is it catering to individual in regions which have limited access? How are you connecting with people who may not have access to these resources, the healthcare resources?
So first of all, I would like to say that I think what Peter just mentioned, that out of the 4 points, which of course beautifully he said that first we need to understand the risk, then we need to understand that what can be done with that risk, and then we need to monitor it, that how are we getting better, and of course putting the alarms at the right time. So this is very, very important, and that is something what we are also focusing on at Curix, that in sexual health, we've created a SHI, which is Sexual Health Index, which is something very, very, very similar to BMI, which tells us that, okay, we need to look to our weight. Similarly, we tell that, okay, you need to look in your sexual health. And it also tells that, which part of your sexual health you need to look at. Is it your self-confidence? Is it your relationship? Is it your mental health? Or is it your physical health? Because all these together creates your sexual health. So that is one important thing. And of course, we are working on the AI part so that, but yes, of course, it will take a couple of years because we all understand that AI takes a lot of data. And in sexual health, there is less data available, so we have to work on that. So it will take some time, but yeah, we are working so that it is more accessible to people freely, where they can understand that what are the risk factors in their sexual health, and how can they improve it, how can they monitor it, and so on. Currently, through SHI and the three pillars which we all know of for healthcare, which is authenticity, affordability, and accessibility. So those are the three pillars Curix also stands on, that we take care that the treatment we are giving for sexual health, they are authentic, they are from certified doctors and certified sex therapists. And that is, I think, the only way a sexual health can be improved, by the combination of the taking care of mental health and the physical health. Then making it affordable and accessible through the digital technology. So this is, I think, a blessing in disguise after COVID, that now health is at least accessible to people in the remotest areas, whether it is medicine delivery, whether it is lab tests, whether it is the right doctor consultation, it is accessible. And in our case, one more thing, that being a little taboo in India, people feel more comfortable getting treatment for their sexual health on a digital, obviously a trusted digital platform, rather than visiting a sexologist. So yeah.
So I think we sort of reaching the end of our session, and so I'm going to throw this question from a call to action, and if we can keep like short, crisp answers, because we are a women's network platform, and this year the theme is inspiring inclusivity. Could you elaborate on the interconnectedness of a women's health, which leads to the overall well-being of the entire family, and any initiatives or programs which you have undertaken, and if you can throw some light? And then, of course, I'm going to ask for a call to action after that. So,
Yeah.
so if you can keep the answers crisp.
Yeah. So I think there's enough data around this, that if the woman of the house is healthy, the children are better educated, they are healthier, and the community that the woman lives in is more economically progressive. So the health of the woman and the education of the woman is something that's really central to any initiative that we bring out. So we do a program called Sehat Chopal that was showcased in the recent G20 held in India, as well as an udaharan of or example of how to deliver high quality healthcare to the communities. So we had a chance to present to the G20 heads of state. So the Sehat Chopal is a program that we do on a daily basis. We reach out to at least 20, sometimes 25 villages every day around the hospitals that we work in. And the Sehat Chopal team consists of a doctor, a nurse, optometrist, and a digital person who makes the Ayushman cards at the point of care. And we do a lot of health awareness drives around the Chopal. So in every Chopal, we are talking to at least 100 to 150 people, majority of them the women of the village, creating awareness about health issues, about better health seeking behavior, how to make sure that their sexual health and their reproductive health is prioritized. So if you see 25 villages, almost 100 people in the village at an average. So we are reaching out to almost 2,500 to 3,000 women every day, raising awareness about their health issues, how to make sure that they seek out healthcare at the right time before, as I said, the costs of the disease spiral beyond control and they become complicated. So because we need to understand that healthcare in India is not just under accessed, it is underserved as well. So there is a lack of doctors, for lack of hospitals definitely, but there is a lack of health awareness also. So in a village, it's very common for people to say, oh, she is old, so she is bedridden, she cannot walk, she can't really see. That's a very common thing for them. They don't even know that a 5-minute cataract surgery can make her see again, a joint replacement surgery can make her walk again. This is the reason, the lack of awareness, that all the Guinness Book of World Records come out of India, right? We have this very happy doctor standing next to a girl with a 20-kilo tumor in their hands. Oh, we removed a 20-kilo tumor. That tumor should have been removed 20 years ago when it was like a 50-gram tumor. The poor girl has been carrying it in her tummy all this life, right? So this lack of awareness and availability of healthcare is something that we try to solve for, and it is a very women-centric initiative that we are doing.
And Peter, your thoughts on that? Any initiatives and call for action?
Yeah, we have two parts that we're working on, and one, as I said, a scalable objective for us, which is in Bangalore or Karnataka. We're looking at about 500,000 women, both from the adolescent age of 12 to 14 to about 25 and above. So it's a huge part, but what is the focus in that space is, most of the Indian women, we all say they are anemic, but how many they know they are anemic? And because of this anemic, we are working with Department of Health and Family Welfare. It's got a lot of other issues, in terms of birth, pregnancy, and all sorts of problems. So we are looking at that part as part of the women health. From the part of the education, and second part is the hygiene part of sanitary napkins, where, or the long hours when they go into the field, many of Indian women, or because of the toilet conditions in the modern place, get urinary infection as well as cervical cancers. So we are working on a technology for modern, called a femiscope, to identify quickly the period cycles, the pregnancy cycles, and cervical cancers. So that is the other part that we are working very seriously on. And I'm also working along with a couple of very good engineering colleges in the healthcare and clean water space. One of the colleges, I was amazed at what they have been discovering. Students and faculty, this is the VIT College of Technology, where I found a technology which I'm really pitching it on, and if you get some good money, tell me.
Yeah.
Okay.
And Shailja, like a call for action to inspire inclusivity.
So, I'll again go back to the basics, which I just mentioned, that call to action is to start with kids. And I think that is what even where we are trying to do. We are trying to educate, and I think that is something which we all should do, that we are trying to educate the parents also about the starting of sexual health and how to handle the mental health, the emotions and the hygiene part of their kids, whether it's a child, whether it's a female child or a male child, and the other genders. So we provide a parent login for, along with the kids at schools, we provide parent login specifically for mothers and fathers, and so that they get educated for both genders, males and females, how to prevent, how to maintain their hygiene, how to take care of their emotional part, how to talk to them, how to educate them, how to normalize things around that. So I think, yeah.
Your message on inspiring
Inclusion, yes. So inclusion for me is two-part really. The first part is including women in general, and I think this was touched upon in the first panel, which Sanskriti was chairing and Aishwarya was part of that panel, that women should not be looked upon as a separate segment. Till we are looked upon as a separate segment, true inclusion can never happen. It's all one, men, women, all one, right? But the bigger inclusion that really bothers me is including people with lesser means, income means, and that needs to be focused on. So my call for action to each of us, no matter what sphere we are in, be it hospitals, be it apps, be it AI, be it Ayurveda, is that we must ensure and we must address the potential disparity of access, to new medicines and to creative innovations and technological innovations. We must address the access disparity that exists. We live in this time of incredible medical advancement, and to make sure that it is accessible to one and all is not just our duty, it really is our moral imperative, and we must take action towards it.
So thank you, everybody. I'm really glad that you all really talked about different topics, from health innovation, from Ayurveda, from sexual health to AI, and that is what Galien Foundation and pre-Modi, Modi pre-Galien India stands for, is about the health innovations in this particular space. For us, of course, Inspire Inclusion at the Women Inspiring Network means it's a movement to pay it forward. And thank you all for joining us on this discussion today, where we were able to discuss about the challenges, the opportunities, the innovations whether it's to do with Ayurveda, to do with gene editing, to, talking about Corex, as well as what Peter talked about, what they're doing at the AI space. So it has been a very, very valuable collaboration for all of us here. Thank you, Tower Capital, Galien Foundation, and we at WIN were privileged to be here. Thank you.
Stuti, just before we close, a very small call to action for everybody in the room.
Yes.
We know that more than half of Indian women are anemic. How many of you have got your hemoglobin levels checked in the last 1 year? And how many of you are anemic? So please, the rest of you who haven't, get yourself and the women in your family checked for their hemoglobin. It's a very small 10 rupee test. And if you are anemic, please start treatment.
I haven't done it, so I'm going to do it this week. So thank you, and can we just have a quick photograph and we can just stand. Sanskriti, join us. Okay, thank you.
Thank you, Stuti. And your panel, they are really, I'm going to discuss a lot of points which are not even the audience is aware of that, and we are really benefit out of it. And you have discussed, compare the Ayurveda with the allopathy, it is really good. And most of the people now depending on Ayurveda.
Yes.
Fantastic for you.
Yes.
Really. Thank you. Thank you. And let me just thank you everybody who has joined this Galien Forum. It is really extraordinary affairs done by the Galien's foundations, which is related to the care of human beings in all over the world. Their presence is also been shown in different countries, and we are really wish them that they should succeed in near future. Okay, let us again meet on evening time in the ceremony award, and look forward to see you.